Hey, how are you doing today?
Hi, I'm well.
Good. My name is Pat. I'm the nurse that's going to be taking care of you today, okay? We're going to do a head-to-toe assessment. All right, and what that's going to involve is I'm going to ask you to do a few things, repeat a few words, take some vital signs and everything before we start. Okay, so let me wash my hands and I'll get some gloves on and we can get started. Is that okay?
Yes, ma'am.
All right. Can you tell me what you're having done today?
I'm going to have a breast reduction today.
Okay, you excited?
I am.
Have you been waiting long for this?
Oh, yes.
Okay. All right. First thing I'm going to do is get you set up with some vitals, okay?
Yes, ma'am.
All right, now I'm going to warn you right away, this blood pressure cuff gets really tight. Don't move around too much because it'll have to start all over you. What it's going to do is get to know you first, okay?
Okay.
And I'm a master at tangling things up. And if this cuff is too big, we'll get another one for you. This is
Okay.
the one they left me with. Now, I just want to let you know, this is for school. Is that going to be okay? It's okay to do this, and my instructor is the only person that's going to see this.
Yes, ma'am.
All right, let's see if we can get going here. All right. You allergic to any medications?
Not that I know of.
Okay. Now, like I said, this will probably get really, really tight.
Okay.
All right. Mm-hmm. Okay. And while we're doing that, I'll go ahead. Is it getting tight on your arm?
Yes.
I'm sorry.
No, I mean, it's doing its
Okay.
thing.
All right, I'm going to go ahead and get your temperature. Okay, this just goes across your forehead. Okay, 98.9. That's perfect. Perfect. All right. I'm going to check your heart rate. Just before I do that, tell me your name and your date of birth.
My name is Shawn Snyder, November 7, 1969.
Okay, perfect. You did that without looking. Okay. All right, the first thing I'm going to do is I'm going to take your pulse, okay?
Yes.
Okay, you got a pulse of 70. That's pretty good.
Oh,
That's
wow.
good.
Lovely.
While we're doing this, let me go ahead and I'm going to check your pulses bilaterally,
Yes, ma'am.
just both arms. Okay, and they're equal. Okay, got a good blood pressure, 126/58. Any problems with your blood pressure? That's a good one. That's good.
That's awesome.
Okay, let me go ahead and take this off of you now. All right. Okay. All right. Now the next thing I'm going to do is I'm just going to check your respirations. I usually do that while I'm checking pulse too. So just breathe normally. Just forget that I'm counting. Okay. Okay, nice even rate of 16. You don't seem like you're very nervous.
I am
Just
a little bit.
Just a little.
I am a little bit.
Now what I'm going to do now is we're just going to go from your head to your toe, check out your neurostatus, musculoskeletal, check your grips, things like that.
Okay.
Now the first thing is, can you tell me what the date is?
October 30,
Mm-hmm.
2018.
Okay, do you know where you are?
I'm in a hospital.
Okay.
Do you need to know the name of the
No,
hospital?
that's okay. All right. Now what we're going to do is check some of your cranial nerves. These are the nerves that control your facial expressions, your face, things like that. Okay. Now I want you to close your eyes and
Okay.
open them really wide for me. Okay, good. Okay, can you smile? Good smile.
Yes.
All right. Now stick out your tongue.
Mm,
Good. Okay, shrug your shoulders for me. All right. Now, can you turn your head side to side?
mhm.
Okay. How about up and down? Any problems with that?
Nope.
Okay. Now, next thing I'm going to be doing, I'm going to shine a light in your eyes. What I'm looking for is to see how your pupils react. Okay. So I'll shine it. It won't hurt.
Okay.
All right. You ready? Just kind of look ahead.
Okay.
All right. Perfect. Your pupils are about 2 or 3 millimeters. Perfect. And they constrict just like they're supposed to with light. All right.
Thank you.
During this, I'm going to be touching you, feeling your skin temperature, things like that. So the first thing I want to do is I'm going to check your carotid pulses, okay?
Okay.
Okay, and we never do it at the same time. That wouldn't be good to your blood, to your brain. Okay, that's good. Now what I'm going to do is listen to them really quickly. We don't want to hear any unusual noises. We just want to hear the blood rushing through. Okay? Might be a little cold, okay?
Yes, ma'am.
You hold your breath for a second. Go ahead and breathe. Hold your breath for a second. Perfect. Okay. Now, tip your head back. I'm looking for to see if the veins in your neck are distended, and I don't see any distension. Okay, good. All right. Now, what we're going to do is I'm going to test your hearing. I'm going to lean past you. I'm going to get you to cover that ear right there.
Yes, ma'am.
I'm going to say 3 words and just repeat it back to me.
Wall, fall, and ball. Wall, fall, and ball.
Perfect. Okay. Now we're going to do the other thing. Do it again. Cover that other ear. Wish, fish, and dish.
Wish, fish, and dish.
Perfect. Your hearing's good. Okay.
I'm glad they don't sound like cuss words.
Yeah, that's good. Okay. Now I just want to check along. Okay, I'm going to feel your pulses here. You got a brachial pulse here. Okay. This one here. Good. Okay, your arms feel good more. Your skin's good more. Check your radial pulses again. Okay, bilaterally, they're good. All right, and your skin is warm on your hands. Skin turgor's good. That means you're well hydrated.
Ah,
All right, now I'm going to check it. Now I'm going to pinch your finger a little bit, not hard, but just look for your capillary refill. Okay, and that's brisk. We'd like to see it less than 3 seconds.
oh wow.
Same thing here, okay? Good job. All right, what I'm going to do is check. We'll just work our way down.
Okay.
I'm going to listen to your heart,
Okay.
okay?
Shall I sit up?
Just breathe normally, okay? Okay, one more just over here, okay? All right, everything sounds great. Next thing I want you to do is squeeze my hands.
Okay.
All right, good. Now I want you to pull your hands towards you, not hard, just gently. Okay. Now I want you to push your hands toward me. Okay, good job. All right. Okay, we're going to do the same. I just want to feel your legs.
Okay.
Okay. Normally I check for a femoral pulse up here in your groin, but I'm not going to do that.
Okay.
Okay, your legs, everything's warm. Okay, we're going to check your popliteal pulse.
Okay.
Yeah, good. I'm going to check the other side. All right. Okay, your posterior tibial, that's going to be right back here. None of this should hurt, okay? Let me know if anything's bothering you. Okay, and they're both equal. Same thing. This is your dorsalis. Sometimes that's a little tricky to find. Okay. All right, now what I want you to do is pull your feet toward you. Just bend them up. Okay. Now push them down like you're on a gas pedal. Push, push, push. Good job. Okay. Now what I'm going to do is one leg at a time. Lift this leg off the bed. Push against my hand.
Okay.
Just lift it straight up. Good. Okay, we're going to do this one. Good job. Everything is equal. Okay. All right. Now the next thing I'm going to do is I want to listen to your lungs.
Okay.
Try not to block my recording. Okay, we're going to listen to the front first and then to the back. We want to listen and see if your lungs are clear. Okay. Deep breath. Let it out. Good job. Again. Oh, real good. Okay, one more time. And once more. Good job. I'm going to get you to sit forward. I'm going to listen to you back, okay? We'll do the same thing. Okay, deep breath. Okay, again. Good. Everything sound clear? I don't hear any wheezing. I don't hear any gurgling, anything like that, any sound of congestion. Okay? Now, for this last thing I'm going to do is I'm going to get you to lie back. I'm going to lower the bed, and I'm just going to listen to your tummy, okay? Listen for some sounds.
Okay. All right.
Okay, go ahead and lay back. Is that uncomfortable for you?
I'm fine.
Okay, some people can't lay flat.
Yes.
Okay?
Yes.
Okay, and you can just breathe normally for me, okay?
Sure.
Okay, everything sounds good. Okay? All right, I'm going to sit you back up.
Thanks.
All right? All right.
Yes, ma'am.
Now, no other questions for me? Okay.
Nothing I can think of.
Just a couple of questions for you. Eat a regular diet,
Yes, ma'am.
not a lot of high-fat foods, a lot of fast food, yes,
No,
okay,
actually,
good.
I'm doing good with that.
Good, okay. Are you a smoker?
No, ma'am.
No, good for you, good for you. Okay. Need anything? I'll be back to check on you. Can I get you another warm blanket or anything?
I'm fine.
Okay.
Yes.
All right, good. Take care. I chose to create a scenario of a patient that I would normally be taking care of, so I enlisted the help of a colleague, Shawn Snyder. She's a surgical assistant, and she is here for breast reduction. So Shawn is a 49-year-old healthy woman. Her skin color is appropriate throughout. No cyanosis, no redness, no edema, upper lower extremities. She's alert and oriented, appears relaxed, answers all questions appropriately. Upon checking her cranial nerves, she's able to do the shoulder shrug, head turn up and down, side to side, without any problems, difficulty, or pain. Her hearing is intact. Her pupils are round, equal, and reacted to light at about 3 millimeters. Moving down, we did her grips bilaterally are strong and equal. Her push and pull of both her feet and her hands are equal and strong. Leg lifts bilaterally equal, and able to do that without any difficulty. Her respirations were 16, unlabored, and upon auscultation, no adventitious breath sounds in any of her lobes. All breath sounds clear and bilaterally in all lobes. Bowel sounds were active in all 4 quadrants. Heart sounds audible with no adventitious sounds in any of the areas that I listened to. No evidence of jugular vein distension. Her blood pressure was 126/58. Temperature 98.9 and heart rate of 70. All normal and for a woman of her age. What I recommended for Shawn would be regular wellness visits, a yearly well woman visit with her nurse practitioner or her primary care doctor. She should be getting a mammogram every 2 years. Pap smear should be done every 3 years unless she's getting the HPV test. In that case, it should be every 5 years. Regular cholesterol checks, make sure that she's keeping her heart healthy by getting enough activity. She states that she eats a good diet, to continue eating a good diet, keep a healthy weight. Also, she's getting near age 50. That would be the year that she would start getting colorectal screenings. I did not assess what her family history is for colorectal cancers, but it would be prudent for her to start those at age 50. Otherwise, she is a non-smoker and she states that she eats a healthy diet. I would just encourage her to continue with those behaviors, and everything was normal for a healthy woman her age.